we're back. Can't wait to do it again. Tyler, welcome back to the show.
It's time.
The Many Minds podcast, where we are collaborating, pooling many minds for better outcomes. I'm Alex Davis, physician assistant. Along with me, as always, is Tyler Murray, nurse practitioner, and the two of us work together at Summit Brain, Spine, and Orthopedics in Lehi, Utah. The purpose of the podcast is to collaborate, to pool our resources together, and ultimately, what can we do to support each other to create better patient outcomes? We're also exploring the spaces where advanced practitioners work, help us to understand what makes your specialty special, and how can we support each other in what we're doing.
Oh, it's my turn.
You're up.
All right. Yeah, general disclaimer, this podcast represents the opinions of myself, Alex, and any guests that we have on the show. The content from this podcast is not intended to act as a medical substitute for medical professional advice, diagnosis, or treatment. As always, we're just here to talk and have a good time. And with that, we want to introduce Jason Gray. Jason Gray, you're in ear, nose, and throat specialty. Is that correct?
So I'm still associated with ear, nose, and throat, but right now I'm mainly in men's health.
And I can't wait to get into this because, first of all, I'm excited to learn, are we stacking plates on the squat bar? Are we crushing protein shakes? Are we just treating the inevitable man cold? What kind of stuff are we getting into?
We could get into all of that if you want. Like we can do a lot of stuff. I mean, especially when we talk about men's health, we want to optimize the testosterone, but we also have some guys that just really do want to just stack on the plates.
Yeah.
And we can help those guys. I mean, it is what it is. Some guys just want to get bigger, faster, stronger. We can help those guys. But our bread and butter, like the guys that really need the help, are the guys that work 9 to 5. They have kids at home. They just need more energy to play with their kids. And that's the game changer for us. That's what we love to do. Because then in our follow-ups, they're like, hey, I have that energy I never had before. I can play with my kids again. And that's what we like to do. That's where it's rewarding.
So how long have you been in this space then?
Almost a year now.
And is it your own practice then?
I'm the only provider at this clinic.
Nice.
Yeah.
Were you approached then, or was it something that you had ventured into?
So I've always kind of had a desire for it based on my personal experience. Years and years ago, I was that dad where I was going home and I'm like, I just don't have energy. What's wrong with me? Mm-hmm. And I went to my primary care provider. He told me I was depressed, put me on my antidepressant, send me on my way. But after a few months, I was like, something's not right. Now I feel worse. I feel like a zombie now on this medication. I got to get off of this. So I went back. And he's like, well, let's do some blood work. Oh, your testosterone's low. And that's where it all started for me. This was years ago. And primary care providers, I mean, everyone's a little different, right? But that might not be their specialty. And so the way I was treated was certainly not the way we treat patients anymore. He put me on a dose of testosterone, saw me 6 months later. And found out, oh, your testosterone dose is not high enough. Let's increase it. See you a year later. And so to me, that's not optimal treatment. We definitely don't do it that way. I knew something was missing. I looked into things a little bit more myself. And I looked into, I explored it enough where I felt like this is really cool stuff. Like I want to be involved in this. I sought out a company that was hiring just an online startup of doing testosterone replacement therapy, or TRT. And I hired with them, or I interviewed with them. They wanted to hire me. I had my letter of resignation all typed up, and then COVID hit. And I felt like I needed to fall back on something that was a little bit more secure still. And so I kind of put it on the back burner.
And your background, you've been in a few different specialties, right, before you got into this venture?
Yeah.
Where else have you been in medicine?
My first job right out of school was actually pretty cool. I was with the team doc, one of the team docs for the Arizona Diamondbacks, doing elbow, wrist, and hand surgery.
Oh, gotcha. Cool.
That was right out of school. So I went to school at A.T. Still University in Arizona. And so that was just a pretty convenient transition because we were already down there. But that surgeon became ill. He had some heart issues and had to close down his practice for a little bit. And that forced me, of course, supervising physicians down.
You got to move on.
Another job.
Yeah.
And so I just took the next available thing. I was literally driving down the road and an urgent care they were just starting. And so I just hey, you need a PA? Ended with Dr. Sheridan on a Friday and started in urgent care on a Monday.
Oh my goodness.
And that was a hard transition because I was focused on from elbow down.
Very specialized,
a year and a half. And then all of a sudden, urgent
whole body.
care. Yeah, and we were dealing with pretty healthy people, like professional athletes. And of course we would treat the high schoolers and the college athletes too, a lot of the minor leaguers. But a lot of these people were healthy. And then I go into urgent care and it's like, oh boy, head to toe, cradle to grave, is what they say, right? And so that was a hard transition. And I did that for about 4 years, moved back up to Utah and went into ear, nose, and throat with Revere Health and did that for a good 7 years. And here I am with Game Day.
You've been all over. You got to tell me about those transitions then. I mean, that's one of the, I guess, the key points of advanced practitioners is trained as general practitioners, general medicine. So you have this ability to bounce back and forth and you can move on to different things. And that's a lot of what we're trying to explore in the podcast is those that want to know what other people's space looks like, because you have the potential to jump around. What's your experience been, I guess, in that vast variety of different clinical spaces?
First of all, I mean, going into school, maybe even coming out of school, you feel like you know what kind of specialty or something you want to do.
Yeah.
And I knew I wanted to do ortho of some sort. But side note, I've also trained some PAs. In fact, I was a preceptor for a Rocky Mountain University student who ended up working for the old surgeon that I worked for in Arizona. She was from Arizona. I trained her up here in Utah. And I was just texting my old surgeon, and he sent me a text, hey, I want you back. How do I get you back to Arizona? I'm like, hey, I'm stuck in Utah now. I love you. You're a cool guy, but I'm stuck in Utah now, but I'm training a student that lives next to your clinic. Would you be interested in her? Anyway, she works for him now.
Oh, that's awesome.
They cover the Diamondbacks games and stuff and send me pictures and rub it in my face.
Of course.
Cool. It's cool.
Yeah.
But so to answer your question, I would always recommend to those coming right out of school, just stick with the general practice stuff initially, just to solidify everything.
Right.
I went into the specialty, elbow, wrist, and hand, and so it was really hyper-focused. And I felt like I learned tons from that surgeon. He was a great guy. I loved the man, and I learned a lot. But then making that transition to general medicine again and urgent care medicine, that was tough. Like, I had to do a lot of studying again and refreshing. I even pulled up old PA notes and stuff. And I was relying on my supervising physician probably more than I wanted to, because they gave me 2 days to train, 2 12-hour shifts, and then said, all right, you're on your own. I even asked him, like, can I have maybe one more day?
Yeah.
Would that be all right?
Yeah.
And so
and then you went back to another niche specialty with ear, nose, and throat.
Yeah. So urgent care medicine was cool, right? I actually enjoyed it. Like I said, I ended up doing it for 4 years, but it was more of a schedule thing. I was like missing kids' events at that point because I was working holidays or working late, and I had to work every other Christmas, and I was just missing things I didn't want to. So I'm like, maybe going back to the 9 to 5 would be a little bit better for family life. And I noticed, and as I was thinking of making another change, I was like, what do I like in the urgent care? Like, what comes in and I kind of enjoy? I was like, I actually kind of like the ENT stuff.
Yeah.
And so as I was looking for other opportunities, I saw Kip Robbins in Provo was hiring. I'm like, maybe it's time to move back to Utah.
Yeah.
I interviewed with Kip Robbins, and man, he is just a stand-up guy. Like, he is just such a good guy. It was a no-brainer to take that job. And so he brought me up and trained me up in his ways. And of course, ENT stuff in urgent care is different than ENT stuff as a specialty. But
what were you doing mostly? Tell us about the ENT world. Like, what was your kind of role in that setting?
I loved how Dr. Robbins allowed me to do procedural things, but also clinic things. I loved that mix of being in the OR, but also the clinic. Everybody loves, I don't know, maybe not everybody loves the OR, but
I'd say most people like to be in the OR.
It's nice. I loved having that mix up. And even in the clinic doing laryngoscopies, and even something simple as using the fancy little microscope to clean out ears and cholesteatomas and stuff. It's fun.
Something gratifying about it, right? Yeah.
It's not like the urgent care clean out the ears where they just shoot some water in it or something. Like, this is a little bit more
send you on your way.
You gotta, like, if your hand's shaking, something could go wrong, you know?
Sure.
I thought it was pretty fun.
Yeah, I like that.
That's awesome. So then fast forward, now you feel like, it seems to me anyway, the impression I'm getting is now it's more of a passion thing where you've got a connection to the specialty and the patient group that you're working with. Is that, I mean, do you feel comfortable now where you've landed at this point?
With the men's health stuff?
Yeah, exactly.
I love it. Like you said, I was actually seeking out this type of opportunity, right? And based on my personal experience, I interviewed with some game day owners, well before the owners I actually work for now, but the timing wasn't right. They wanted a part-time guy, and I'm like, I just need something full-time that has some benefits. I have some kids to take care of, right? So I didn't even end up going to the other interviews they offered me. I just felt like the timing wasn't right. And then several months later, I saw another post on Indeed for a different game day franchise. I thought it was the same owner, so I ended up emailing them. I'm like, hey, is there any opportunity for full-time yet, or is this still just a part-time option? And they emailed me back, hey, we actually don't own that clinic, but here's the email address of the person that does. And so I ended up emailing that person, and they emailed me right back, like, we'd love to interview you. Let's work something out.
Yeah.
And that's kind of how the cookie crumbled.
That's awesome.
So this game day, is it a franchise then?
They're all franchises. Yeah, it started in California many years ago, and slowly it's just been sweeping across the U.S. and now in Canada.
Wow. Yeah.
So tell us a little bit about your day-to-day then. What's life like in the specialty of men's health?
So let me preface this because it's a little bit different with the franchise and starting up, right?
Right.
When I first started with them, we were starting from ground up, right? We didn't have
brand new business.
I wasn't walking into a patient load. We had to find it ourselves. And so when we first started, we were open like Monday, Wednesday, Friday. And sometimes not even those full days because we just didn't have the patient load.
Right.
Yeah.
So some of those off days, I was going with the general manager to like CrossFit gyms and recovery places like Chiller and stuff like that, introducing ourselves to see if they could just kind of start sending people our way. I was visiting primary care offices left and right, lunches with like Revere Urology and stuff, just establishing those relationships. And eventually we started getting busy enough where it's like, okay, we have our 3 days. Now we're going to go 3.5 days. And now we're going 4 days. And now we're open every day of the week.
Wow.
And we're staying pretty busy, which is awesome. In fact, 2 different urology groups, both of them have said, we don't want to treat testosterone patients anymore. We're sending them all your way.
It's like an automatic referral.
Yeah.
And so it's been really good.
That's slick.
What's your patient load like in a day then? How many do you see in, and what kind of pathologies are you working with and patient populations?
Good question. Because it's totally different than your normal medicine. Like I went like ENT stuff. It's like you're seeing 30 to 40 patients a day, like in, out, in, out. Some visits are 5 minutes, right? With this, it's a little different because there is a business aspect to this, if we're being honest.
Yeah.
And sometimes I'll visit with a patient for a full hour. Like we'll really take our time. We really want them to understand the ins and outs before they even sign up and proceed with treatment. Some visits, like our follow-ups, they might be 10, 15 minutes. But our new patients, it's a lot longer. And so I might only see maybe 10 to 12 patients in a day. Like it's totally different than what I mean, urgent care. There was one day in the urgent care I saw 60 patients in a 12-hour shift, and I was exhausted.
Goodness.
That's just so many patients. It's so much volume.
My thought always is not even the patient volume; it's the charting. You have to do 60 charts
for real.
It's endless.
That's horrible.
Yeah,
that is horrible. And this has the charting is a little bit simpler because it's all. Like we don't have to follow the rules of the insurance.
It's game. Not. I was going to ask that.
This is cash pay.
It's cash pay system.
Cash
okay.
Pay, so we don't have those handcuffs.
Sure.
And I love it. I have maybe 1 or 2 patients that request ICD-10 codes just so they can submit stuff to their insurance for some reimbursement, but they pay cash up front and then submit that for reimbursement. But other than that, I don't even have to put a diagnosis on there if I don't want to. I mean, we do, right? We have to do the medical legal stuff.
Right.
But other than that, we can put as much on there or as little on there as we want.
Right.
A lot more freedom that way.
That's nice.
That's helpful.
But
so
you mentioned also like age groups or whatever.
Yeah.
Being in this space, I mean, we get the 18 to 25-year-olds that come in. They want to get jacked. You know? Right. They just want to get big. And dude, this isn't the way to go for you. Like we're pretty transparent. I've had to have some bold conversations with some kids. It's like, dude, we could compromise that hypothalamo-pituitary testicular feedback loop. You want to have kids, well, your sperm count's going to go down. Like, we have to have these conversations. There are other options, like we can use a selective estrogen receptor modulator or something and boost testosterone without affecting that axis, but we have to have some real conversations with the younger guys. but we're seeing a lot of the guys in their 30s, 40s, 50s. That's kind of the bread and butter.
Yeah.
But obviously the elderly, they need help too. So, and I mean, they need it big time.
So it is real medicine then.
It is real medicine.
Okay,
It's
good.
crazy.
I'm just messing with you.
I know. and that's the hard thing though, because there is this balance with this type of thing where there is business and medicine.
Right.
And I'm grateful that we have an awesome general manager and we have awesome owners who know, first and foremost, the patient comes first.
Yeah.
Even though this is a business part of medicine, the patient comes first, and patient care is super important to them.
Yeah. So what kind of treatments are common there? What kind of things? It seems like in these specialties, in our world, it's going to be the same. You run into your top 5 or 10 conditions that you treat.
Yeah.
Right.
I mean, we offer 3 main treatments of testosterone. You're going to read about all sorts of things, right? Intranasal testosterone replacement therapy, transdermal patches, creams, gels, whatever. We stick with 3 core ones. We have oral capsules, and it's not the oral tablet from years ago that destroyed the liver and you were only using maybe 10% of what you were ingesting.
Right.
It's a newer one. It's Kaisertrex. It's an oral capsule. We use pellets. We use injections. Those are kind of the 3 main testosterone replacement therapies that we do. Of course, Game Day offers peptide therapy, vitamins, weight loss. We do some other things too, but the bread and butter is certainly testosterone replacement therapy.
Gotcha. Yeah, and I don't know if you guys have experienced that as well, but I've kind of seen through the grapevine that sometimes we'll see females in these men's health clinics as well. Is that accurate?
Yeah. Our machines are actually calibrated for men. And so we're transparent with them. Like, we don't treat the female hormone stuff. Yeah. Like, they can come in, we can draw their blood, we can send out for a female hormone panel, but then we just kind of have to recommend that they go to a female health place. We don't treat the hormones, but we have plenty of wives of patients and so forth that want to be on the weight loss stuff.
Yes,
GLP-1s, we do a lot of that for the ladies.
Yep.
And are you managing that then?
Yeah.
So you're the sole provider for that franchise clinic?
Yeah. And we're in Pleasant Grove. They're going to open up another one in Provo, hopefully in the next couple months.
And then will they hire somebody to man that?
Dude, they're going to have to. I can't be in 2 places at one time.
That's true.
But we are busy enough where, it was a skeleton crew for the longest time. We'd have our front office gal, we'd have our MA, we'd have me, we'd have our general manager, and that's it.
Wow.
But we're busy enough now. Next week, we have another MA starting with us. We're going to, like I said, we're going to open up another clinic where we're going to have to bring on another mid-level. We're just going to continue to get bigger.
So you said you're open 7 days a week?
Oh, figured it was 5.
5 days a week.
5.
Okay.
Yeah.
I was like, I just want to make sure I clarify that, because I'm like, you're in the clinic 7 days a week?
5 days.
All
feel like it's 7 days sometimes. They have this on-patient portal access where they can message me at any time.
So it's like a concierge service.
It seems like it, because they're cash pay. It's a subscription type of service.
Exactly.
So they basically can get access to you as much as they want.
Yeah.
Oh, that's nice.
I draw my own boundaries where over the weekend I'm like, I'm not going to message it back. I might see the message come in, make sure it's not urgent, and then you have to have your boundaries.
Speaking of that, how does that affect if you want to take a week off or take a few days on your own and there's not someone else in to cover the clinic?
It's hard, because with the way we do things, we mail, for example, our injectable guys, we mail everything out. Well, I say the pharmacy does. I send them the prescription, the pharmacy mails it to them, and it's on an every 4-week basis. And so if I'm not on top of those, we have some angry guys.
Right.
And so even Christmas morning, I admit, I woke up early before the kids, and I hurried and did all my refill stuff, because I'm the only guy. It all falls on me. If I don't do it, I have to deal with the angry patients.
Yeah.
Even President's Day's coming up, I have the day off. Well, I already have a note in my phone on Friday, make sure to take the work laptop, because on Monday morning I'm going to have to do those refills. We got to stay on top of it. So that'll change, of course, when we bring on somebody else. But
as things continue to grow, I can imagine that.
Yeah, and I knew getting things started that there would have to be some personal sacrifice in getting things rolling. But it's been worth it, dude. It's been fun. It's been fun.
I want to know about the training aspect, because I know you had been, taking testosterone yourself, you said, so you're probably well versed in that setting, but did you know enough walking into that to then turn around and say, I basically know how to treat every...
I love that you asked that, because I thought I knew it.
Yeah.
But my care was based off of this primary care provider who I learned, okay, maybe that's not the best treatment.
Yeah.
And by the way, the owners, when I interviewed with them, they didn't know I was on testosterone before they hired me.
They had no idea.
They had no idea. And so it was kind of fun to be like, hey, actually, I kind of know this, and this afterwards. But what we did with game day, they fly out to California to their main facilities, and you shadow some of the providers. They have you undergo some extensive training for a few days while you're there.
More than 2 days.
More than
the
the urgent care.
Yeah. You felt a little more equipped. Yeah.
And the funny thing is we have a medical director, right? And he was there with me. He was sitting in the classes with me, and we were going through a bunch of the information, and he taps me. He's like, "You ready for this?" Because our clinic was literally going to open in 2 weeks from that. Was it 2 weeks? It was somewhere close like that. And I look, I'm like, no, but I have a good supervising physician that can help me out. And he looks at me and shakes his head because he's like an ER doc, you know?
Yeah.
I'm like,
shoot.
It hit me right then. I'm like, okay, I really need to listen.
There's really not much of a safety net here.
Yeah. If I have a question, I don't know if I can ask that guy.
How is that interaction with the supervising provider?
He's such a cool guy. He's so fun. Like, I mean, we deal with genitalia, right?
Right. Yeah.
And I feel like I need to be professional about it. He's the one joking about it. Like, he's just a funny guy.
Yeah.
Our whole staff's pretty funny that way. But
is he on site with you?
No.
Okay.
He pops in a couple times a month, maybe once a month. We always have a meeting at the beginning of the month. We have a big lunch, and everybody gets together, and we go over goals and whatever. And he's always there. Mm-hmm. But he'll text me. Sometimes he'll text me just to let me know he's reviewing my charts, you know, like, hey, there's a typo. I'm like, really? Really? Come on.
Yeah.
But I think it's just like, hey, just so you know,
I looked.
I'm reading your charts.
Yeah, of course.
I'm still involved.
Yeah. But he's a cool guy. Cool. We text all the time. He'll find a good reference book, and sometimes I don't even know. I'll look on my porch, and he had gone on Amazon and sent me a book he wants me to read about testosterone replacement therapy or whatever.
Love that.
So he's
nice.
a good guy.
Good relationship then.
Yeah.
How about the flip side of the coin then, as far as compensation and pay? It's going to be a bit unique. I'm assuming in the scenario where you're a startup business and kind of you don't have like another reference to base it off of.
Yeah.
How has your model worked out, and how do you feel about it?
Well, I came from Revere to this clinic, and Revere, they offer a pretty good total compensation,
which is a big, if you don't know, if you haven't heard before, Revere, a bigger company, physician-owned, multi-specialty company. They're pretty widespread in all the different specialties and a bunch of different clinics locations. So a big company that you were part of.
Yeah. And so they offered a great compensation package with healthcare benefits. They would reimburse me for my cell phone because I was on call all the time, and even pay part of my gym member, like just little things that add up. You know?
Yeah.
And so going into this, and the owners were transparent with me too. It's like, hey, we can't offer that kind of stuff. We're just kind of getting going. And so they took a gamble on me being one of the first full-time providers, because usually they hire part-time providers to get things going like this. They took a gamble on me to have me come on full-time, and I took a gamble on them taking a pay cut.
Yeah.
Knowing I would rather make less money doing something like this than continue doing what I'm doing. Not that I had anything, I didn't have any beef doing what I was doing. I just felt like there was something more for me. Again, I'll never speak negatively about Kip Robbins or his office. Fantastic people. Like I say, I still have connection with them. But I knew I wanted to do something else, so I'll take the pay cut. So I took a pay cut in base salary and benefits. They were kind enough to offer me some healthcare benefits for me and the kids and stuff. But then they presented me with this bonus package. And again, this is a business, right?
Right.
And so they offer me, hey, what if we gave you 5% of all the incoming revenue each month? I'm like, this could make up for the difference.
Sure.
If this could really take off. And again, it's a gamble.
Yeah.
But it was a gamble I was willing to take. And so far, it's been good.
Yeah.
Nice.
Yeah.
How do you feel about that structure? Would you take something like that?
Yeah, absolutely. I think that's forward thinking, right?
Yeah.
Like I think you're looking at the long ball game. You know, you're gonna hit the ceiling in these bigger organizations where if you start with a practice or, you know, a company that's just developing, you can position yourself in such a way where 5% right now maybe not look like much, but 10 years down the road it could be a big deal if they're super, as far as profitability is concerned. So I don't think you pass up on something like that.
I agree.
Yeah.
You can only go so far with just your professional 9-to-5 job. You've got to diversify and have other options.
And that's why I was like, I just got to do something different, because I felt like, I was full time at that ENT job for over 7 years, but my last day compared to my third day, I was doing the same thing. Like I did hit that ceiling, and there wasn't any professional progress there. And that's what kind of bothered me. Like, there's something more for me.
Yeah.
And so I went to find it.
Gotcha. What kind of advice do you have for someone else in that situation then? 'Cause it seems like you've done well and taken some risks and it's worked out, but what kind of advice would you have for other providers in that scenario? Maybe they're a little bit stagnant.
Well, if you have the opportunity, don't be afraid to jump. I mean, PAs, NPs, we have that opportunity. Might as well take advantage of it, because if that opportunity doesn't work, there's going to be another one.
Mm-hmm.
But I don't know. I just got to the place where I was like, I've plateaued here. Time to make the jump. I was scared for a long time.
I think it's important to make connections, because it sounds like you were able to kind of cement yourself in one area, but still were kind of diving into these other spaces and making connections. And then your willingness to go outside your comfort zone and email people and reach out personally to try to figure out if there's opportunities, right, where you're passionate about. And I think that's something that I think we all get timid with. Like, you don't want to expose ourselves to failure. And I think that in this light, that's the only way you're going to win. You got to take the risk.
You got to fail faster. That's how you get over it.
That's it. So I love that.
Yeah,
I love that.
Reminds me of Viet that was on early on in the show.
Oh, yes.
I'm probably going to butcher it how he said it, but it was like fail fast. No, it was feet first, fail fast, fall forward.
Yep.
Oh, I love it.
Right? Yeah.
That's great.
Yeah, I thought it was really good too.
I don't think you slaughtered that. That was good. Even if that's not how
I probably did it. I probably did it better. Don't tell me. Yeah, but no, I think that's great advice and a living example right here with Jason, who's bounced around quite a bit, and I think eventually
failed a lot. Is that what you're saying?
No. Dang it, take that back.
I'm just joking.
But eventually found and landed in a great spot. It sounds like.
It's been good.
How can we as a community support what you guys are doing? What's the right patient to send over there? How could we optimize the situation and provide better care for the community?
Sure. Send the guys that need just more energy, more vitality of life, because it's out there. So often I hear in my office, well, it's this way because I'm getting older. Dude, it doesn't have to be that way. We can improve that energy level. We can improve that sex life. We can help that marriage.
Yeah.
It's awesome to me. And that's another thing. I mentioned that it's awesome that we can help these guys have the energy to play with their kids, but we also help these guys improve their marriages. Like, believe it or not, I mean, we often think it's always the guy that wants to engage in intimacy or whatever. Well, sometimes it's the woman, and the guy doesn't have the libido he used to have. We can help that.
Yeah.
We're helping marriages. We're helping families. Send them our way. We can help them out.
That's really cool. That's really cool. What would you say is kind of the up and coming future in men's health? What are the innovative, or dare I say trendy, topics in men's health? So, I mean, TRT, like intramuscular injections and pellets and stuff, that's kind of been tried and true for years and years and years. Something that Game Day has been doing more recently for erectile dysfunction is the P-shot. I don't know if you guys have heard the P-shot. You know the P-shot? I don't know the P-shot. Maybe that's a good thing you guys know about the P-shot. But basically, we take your blood and we spin it down. We take the platelet-rich plasma. We inject it back into the penis to help encourage blood flow and help with erectile dysfunction. Interesting. It's been pretty darn effective for a lot of people. We like to couple that with the Gaines wave treatment, the high-frequency acoustic wave treatments. That helps increase the availability of nitric oxide and enhance blood flow to help people with erectile function. So I don't know if that's new and innovative. That stuff's been around for quite a while, but the fact that you're taking PRP and putting it back in the penis is kind of a big deal. PRP, I've had a fair amount of background in orthopedics and sports medicine, and that's been around for a long time. Hot topic, but I can't say I've ever heard that injected back into the penis. I know. Nor have I heard of anybody asking about that. So honestly, new to me. Like, even just a few weeks ago, I got an update saying they're doing it intratesticularly now for testicular size. I'm like, oh, I don't know about that. I don't know about that. I'm not going down that road yet.
But
Are you doing those procedures?
so I do the P shot.
You do the PRP.
So
Okay.
yeah, on patients.
Sure.
Clarifier, disclaimer.
Yeah.
But I haven't done the intratesticular injection. That's like brand
Yeah.
new stuff that I'm like, I'm gonna let them work out the kinks first. But the P shot's been tried and true. Like it's been helpful to a lot of people.
And is the P shot like a one time? Like how often do
Good
you?
question. So we don't like to repeat that for at least 6 to 8 weeks because sometimes it takes a while for full effect. But usually people get by with just one, but sometimes it might take 2 or 3. If it's more than 3, they're like, you're just not responding well to it.
Nice.
The P shot.
The P shot. Who decided to name that?
I know.
Well, in fact, the full name is the Priapus shot.
Priapus.
Yeah.
The P shot.
That's okay. So that gives me a little more information because I was still wondering a little bit.
And in women's health, they're now doing an O shot, which is the same type of thing to increase women's orgasms.
Wow.
So
Yeah.
that's out of my wheelhouse.
Years,
but-
again,
yeah.
you're like not going down that lane.
No.
That's fair.
That's fair.
Totally fair.
Okay. I think we hit a stopping point there in that conversation.
None of us want to talk more about this.
No, yeah. I think maybe for a different type of podcast. We'll probably hang it up there. Good information. Thanks for sharing. What else oh, story time. That's what I was going to get to.
We didn't leave the cliffhanger.
We never left the cliffhanger at the start, but we would love to hear just something fun, entertaining, memorable, funny, heart-wrenching, whatever you got. I want to hear something from your past in any of your settings of a great patient interaction story.
The first thing that came to my mind when you initially asked me that was an experience I had in the urgent care. I had a gal that came in. She just had this fishy odor that she had for quite a while, and she would shower like 5 times a day, she said. I don't know if she really showered 5 times a day, but it just wouldn't go away. And she couldn't think of anything hygienically that was going on. And so, of course, we kind of go through a review of systems. Come to find out she had some vaginal discharge. And so we had to take a look. And so I had my MA in there with me. And, oh my gosh, sorry. When I think about it.
You're sweating a little bit.
Oh, man.
I thought we were off this topic, but we're right back to it.
Okay, we're right back to it. I'm sorry. I tell you, as soon as that vaginal speculum opened and that air hit me, holy cow, that smell.
She wasn't lying.
She wasn't lying, dude. It was so bad. And I could see something in there. And so I had to get some forceps, and I had to kind of go fishing a little bit. But I ended up pulling out a tampon, and I couldn't even ask any questions or anything. The odor was so foul. I was starting to dry heave, and I didn't want her to see it.
Sure.
And so I plopped that thing in the biohazard box or can, and I just ran out of
Gloves
the room.
off, and I got to take a break.
It was embarrassing, but I went into the next room, and I was dry heaving.
Oh, man.
And I thought the MA would just stay in the room with the patient, but she was next to me, dry heaving. We were both going at it, and it was so bad. We ended up needing to shut that room down the rest of the day.
Oh, my goodness.
man.
And people could smell from down the hall, even with the door shut.
Oh.
Something was going on in there. But needless to say, that thing had been in there for quite a while.
Oh,
She didn't have toxic shock syndrome or anything.
That's good.
That's
What a weird encounter in ENT.
Oh,
What
that
kind
was
of
an
stuff
urgent
were-
care.
I know,
sorry.
I was just kidding.
Oh, golly. Oh, I'm like, did I say
while I'm
ENT?
here, could you check this out for me?
Yeah.
Right.
Oh my goodness.
That's awesome. Well, I think we might have a new winner for our top story.
No.
We've had a couple good ones. We'll see if someone can top that.
We had some good ones.
That was pretty good. Well, this has been fun, Jason. It's awesome. It's fun to catch up. Fun to hear what you've been doing and how you've been progressing and providing, giving back to the community.
I appreciate that.
Tyler, what'd you learn today?
Jason, I respect what you do, man. Really, I think it's cool. I like the idea of you venturing off into this space, a little bit of, for me, an unknown territory, in that it's just like a premium service that's offered to, you're working mostly with the male population with testosterone replacement therapy. But I just think it's a cool niche, and I think you found a good position. So shout out to Game Day. It sounds like they're doing the right things. But overall, I've been really impressed. I mean, it's a good vision, and I'm with it. So I'm gonna keep my sights on you, man.
Awesome. Thanks. Appreciate it.
Your appointments next week?
Shoot. In fact,
sign me
you
up,
might
man.
as well. So we actually
When I get home, I'm too tired to play with my kids. I need some tea.
I need some tea. There
Here's
you go.
the thing: we offer our first consultation is free.
Oh,
a
there
guy
you
will
go.
come in.
Hey,
Hey,
let's do it.
all right.
We
Any-
do have the gym bros come in all together and compare their testosterone.
Oh,
course,
I'm
of
sure.
course.
But we do offer the first consultation is completely free. Come in, get your testosterone checked. We'll chat, see if we can help out.
That would be something like the orange pill. They'd have all your stats on the board, and people
yeah.
can walk in and like compare. Like, yeah, that's me.
Yeah, we should take them up on it. We got to go visit sometime.
Yeah, we should. We should.
Okay.
We should go
Do
check
it.
it out.
We'll come see your space. I'm excited.
Pleasant Grove, just off of Pleasant Grove Boulevard and I-15.
I love it. And that was kind of what I was going to lead into next. So if somebody wanted to reach out to you and connect, had some follow-up questions or find your clinic, how do people connect with you?
Even if they Googled Game Day Pleasant Grove, we would pop up real quick. Like I said, off of Pleasant Grove Boulevard, I-15. We're on Instagram as well. We should be able to hook you up pretty quick.
Game Day Men's Health, Pleasant Grove. How about you personally? You got any social media outlets?
I'm not a huge on social media. Like, I'm not a huge social
yeah.
media
That's
guy
all right.
personally.
Welcome to the club.
I mean,
yeah.
I mean, I have Instagram, but it's mainly just to keep in touch with people here and there. But
Yeah.
You don't want to shout that out to everybody so they can get in your DM.
I probably wouldn't even see it.
Is that what they say now? Get in your DM?
Dude, I don't know.
I think that's right. We're going to roll with it.
Okay.
He has no idea what he's talking about.
Sounds like you know more about that than we do. So,
Yeah.
Love it. Well, we're kind of similar. I don't think Tyler and I have a big presence, but the group, our company does. You can find us on Instagram, Summit Brain, Spine, and Orthopedics, on YouTube, where you can see videos of the recording here today and many other videos and surgical videos and educational videos, all kinds of content on YouTube, Summit Medical Institute. And then we really like to connect with people in person, so come see us Tuesday mornings, every Tuesday morning, 7 a.m. We have our multidisciplinary in-person case discussions at the Mountain Point Hospital in Lehigh, Utah. And as always, like to make a shout out to our production team, Dallin and Amelia. We appreciate all the help they provide for making this happen. Tyler, I appreciate you too, buddy. Thanks for being here.
You got it.
Looking forward to more episodes to come. Please stick with us. Give us some comments. Some feedback. Things that you like. Things that are working well. People you'd want to see on the show. If you yourself want to come chat with us, we'd love to have you. But either way, give us some feedback and let us know how we can keep improving. What are you looking forward to?
We got a couple good ones coming up. I'm excited.
Can't wait.
Let's keep this rolling.
We'll keep it going.
All
We'll
right.
finish out today, though. This has been another episode of the Many Minds podcast, where we use many minds, collaborative efforts, trying to create better patient outcomes. I'm Alex Davis.
I'm Tyler Murray.
Thanks for sticking with us. We'll see you next time.
It's a wrap.